and welcome to Philly Live. I'm Sheila Watko. Many adults don't think about seeing a doctor until something feels wrong, but regular visits with a primary care physician, or PCP, are one of the best ways to protect your health. From preventive screenings and vaccinations to managing chronic conditions and coordinating even specialty care, a PCP plays a central role in helping you stay healthy. This morning, we are joined by our friend at this point, Dr. Riccobene. So great to see you from Independence Blue Cross. Welcome back to the show. Always a pleasure to have you here.
So, Sheila, thank you again for having me here.
Yes.
And then I want to talk about primary care.
Yes.
There are three types of physicians that are really considered primary care: pediatricians, internal medicine, which is what I am,
yes,
and family medicine.
Excellent.
And we'll talk more about that.
And this is even for people who already feel healthy. You still want to go set up a primary care physician that you can have kind of as your go-to, or a PCP. Why is that?
So it's about priorities. So sometimes, you're a younger person, you have a close relationship with your pediatrician, you graduate from that when you're a young adult, and then you're feeling healthy and you don't think you need to, you don't prioritize that because there's so many competing priorities. Yeah. But there's three reasons. I'm going to give you three examples
this
why
sounds great.
You should do that. So the number one reason is that primary care clinicians have a lot of resources available to you. So when you see one, they'll go over your family history, they'll do a complete physical exam, they'll talk to you about your mental health as well, and screenings, because there are screenings that you need to have even when you're younger, such as blood pressure, cholesterol screenings. They'll talk to you about vaccinations and then cancer screenings as you get older. So lots of resources that you would miss out on. The second reason is that some of the chronic conditions that are around, like high blood pressure, which is very common, actually don't have symptoms initially. So you might actually not know that you have a chronic condition. And if you saw a primary care doctor, they could actually identify that your blood pressure was elevated, and do interventions that don't require medications, such as lifestyle, diet, exercise. And so you could actually delay the need for medications.
Oh, wow,
which is also
great.
Yeah, it is great. And the third reason is, for your viewers who are still kind of thinking, oh, I only think of going to a doctor when I'm sick, is think about going to a primary care clinician kind of like you would treat your car, which is you take your car in for checks, even when it's performing well.
What would you say are the biggest health benefits of having that ongoing relationship once you set that up with your PCP and being able to take that forward?
So having a primary care relationship is like a continuum of care. And so think of your, to use a team analogy, think of your primary care office as your healthcare team. And your primary care clinician then is your quarterback. So they help provide consistent care, they help coordinate care. So for instance, if you did have a chronic condition, I mentioned blood pressure before, this time I'll mention diabetes, they'll actually check your sugars, talk to you about your diabetes, evaluate your meds, but they may want to refer you to a diabetic specialist, known as an endocrinologist. You should always, if you're diabetes, you always need to go see an eye care specialist. They'll just make sure all that other care is coordinated as well. And then healthcare can be so complex that basically they're there to help you understand your benefits and the resources. So your primary care office is like your healthcare team, but I also want to call out that your insurance company can be like a booster club.
Okay.
So basically meaning that you could go to them if you have questions. We, for instance, at Independence Blue Cross, have digital tools. We also have a customer service team. If you feel like you need to speak to a clinician and you kind of have questions, you can actually call and ask to speak to a nurse health coach or a social worker if you have financial questions.
They make it accessible. This is great, great information. And a lot of people only go to urgent care or a specialist when something feels wrong. What would you say to someone who doesn't have that primary care physician? Yeah,
basically though, specialists and urgent care are incredibly important tools, but they're not comprehensive.
Sure.
And you definitely, they're not standalone. So for instance, an urgent care is very helpful. And I think most of us have actually either been to an urgent care ourselves or taken a loved one to an urgent care. So for instance, if you have a joint issue, they have x-ray equipment, they can do an x-ray and evaluate you. A specialist have a lot of training in a very specific part of your body. And again, that is wonderful to have, but a primary care doctor looks at you comprehensively. So again, hopefully by the end of all this, everyone's getting that to live a longer, healthier life, you really should have a primary care relationship even when you're feeling healthy.
Such important information for our viewers. So thank you so much, Dr. Ellen Riccobene, for sharing that with me. I always learn something when you're here, and that means our viewers are learning something. So
yeah.
Always great to have you here, and good to see you again.
Thank you.
For our viewers, for more information, you can visit ibx.com. And thank you all so much for watching Philly Live. We will see you next time.